Hi, Dr. Ace there. We have another video of a new patient that found us on YouTube. And actually her husband, who's standing right there because he's too chicken to be in the camera, found me, and he was supposed to come in first, but he's now getting his wife in here first because she has a lot of symptoms. She came to me, before I go on, she's been going to chiropractors for 30 years.
Yes.
She fell when she was 16? 13, and you fell down the stairs, paralyzed for a few seconds, had some severe problems back then, went to a chiropractor after that?
No, when I was about 4 years later.
4 years later, okay. That was, she thinks, her first incident of why some of the stuff went out, but 4 years later went to first chiropractor for low back pain. That's right, low back pain. She's gone to 3 chiropractors, she says, over 30 years. The travesty of all this, and this is a little bit of my soapbox right now, is that over 30 years she has had pain, and she believes in chiropractic. Goes to acupuncturists, has herbologists, has all different types of healers. Really is a searcher for healers, and so that's wonderful. But the chiropractors have let her down, and they've let her down because 30 years she's only been adjusted in her neck one time. And that was last year, right?
About a year ago.
And it wasn't even that good of an adjustment, and they didn't even follow it up again. One time in 30 years. Frickin' travesty. That's absolutely gross. I can't even stand that I hear that even happen. So that's my soapbox. Anyways, I had to say that because that just absolutely blows my mind. So she's been on the flexion distraction, the DRX
9000.
DRX 9000. She said it helped a little bit, but she's still here because nothing seems to help. Now, she had surgery in
2009.
Okay, what was that for?
Herniated disc.
Okay, and what had happened to that disc?
Well, the surgeon said that it blew out.
Good.
It just completely blew out, went into the spinal canal. They had to go in and...
And you had drop foot. She had drop foot. Yes. She had massive neurological problems because of that herniation. So she went and had the surgery, and then almost immediately after, or relatively immediately after, what started happening?
Just pain down my right leg. I get cramps from my ankle. It just, from the ankle up to my knee, just massive cramps. The one thing that did occur is that her foot drop was less after the surgery. That's good. But she, relatively, everything else was still there. Pain, leg, down the same leg, right leg. So it took care of maybe the severe foot drop, which I guess you could call a success. But she's been suffering for years now. Right. 6 years since the surgery. Right. Okay. And I wish I had the disc right now to show you the herniation, but we left it home. It's okay. Believe me, it's big and nasty, and there's probably a reason to cut it out. Okay, so tell me. Okay, so tell me some of your symptoms here. You have right neck pain, yes. Right. So just kind of go down the whole thing. Right neck pain, yes. Right arm numbness. Yeah, in the morning my hands are numb.
Hands are numb, the right hip, the leg, go down the leg, your right big toe, your hands are swollen, yes, right? Both of them.
In the morning,
and the right is worse than the left. Right. Okay, so it's the common theme I'm trying to bring up here is that the whole right side of her body is shut off. Right. We've talked about this before. As pinched nerves occur, and they cause a closure of those nerves, which cause a problem. Well, her thing is that her whole right side, from the top down, is shutting off. So it's like the faucet of a hose. So you turn the faucet off, it doesn't matter what's happening to the hose. The whole faucet's off, so her whole right side of her body is completely shut off. And she has some left-sided problems too, but it's majority right.
Right.
Gotcha.
Right.
So it's her atlas. You guys know that. I know that. We're going to start working on her today to show the difference. Okay, so she has knee pain, wrist pain, she has headaches. She doesn't have ringing in the ears. I don't know why that, but she has nausea 2 to 3 times a week. Acid reflux, the worst ever. How much do you have it?
All the time.
How many years? Just roundabout.
At least 10, but like the last 3, it's been severe.
24/7. Doesn't matter if it's spicy food, nothing. We're going to help her with that too. Okay, so let's see, one other thing. The most interesting thing to me is over the last year, the hearing is gone and the eyes have changed. Tell me about that.
About a year and a half, I guess. Just my eyesight's gotten really worse. Got glasses, and it's still getting worse. My hearing is like just diminishing. I feel just like all the time getting less and less.
But noticeably in the recent time.
Most recent, I would say the last 6 months to a year.
Okay, fair enough. So that's interesting to me because, again, this is associated with chiropractic too. Not that anybody knows that out there, but we're going to do this work on her today. She's not going to have a miraculous hearing change right now, but I guarantee on the follow-up video, she will be better. Okay, good. So Let's, anything else you want to tell me?
I think that's
good. Let's do our pre and post over here. Okay. So, go ahead and touch your toes. We'll see how you're at, right where you're at right now. Okay, so she's pretty bad range of motion here, but how's your back? Does your back hurt right now?
Yeah, my lower back.
On this side, the middle, on the right?
The right side.
And does it go down your leg at all?
Yes.
Okay, go ahead and stand up. Okay, go back like this. Okay, how about that? Pain at all?
A little bit on the right side.
A little bit on the right side. Yeah. So more when you went forward. Go ahead and stand up. Right. So put your arms at your side. Go ahead and look down, please. Pain in your neck or your back anywhere?
Right side of my neck.
Up or here or down low?
Lower.
Lower? Okay. Look at the ceiling, please. How's that?
That's okay.
That's okay. Yeah. Good. So we're going to adjust her neck. We'll see how she does. So go ahead and lay down here. Dodi. Dodi's your name. Yes.
Yes.
I haven't said your name yet. Go ahead and lay back here. Okay. Now, Dodi, justifiably, is really scared because this is her second neck adjustment in 30 years. And so I'm going to be really slow on you, Dodi, okay? And I'm not going to jump on you until I tell you. We're just going to touch your neck. I'll kind of show you what's going on first, and then we'll go from there, okay? See? All this scared, all fear. But she's come. How far do you guys live? Hour and a half?
Riverside.
Yeah. Hour and a half to come here. One way to get this one neck adjustment. You chiropractors should be doing neck adjustments. So we're just touching right now, okay?
Okay.
So what I'm gonna do is I'm just kind of feeling around right here, okay? We're not going for a home run today. We're just gonna get you started here. I'm gonna adjust right here in the middle of your neck. See, you feel all this tension here? It's all tight. So all I'm gonna do is I'm gonna put you in a position like this, and do you feel that, how it's tight right there? And that's how I'm gonna adjust you, okay?
Okay.
It's really simple. Keep your hands right where they are. There's no real special breathing on this. You just relax the best you can. Like I said, I'm not going to go for a big adjustment, just real small, just trusting, okay? And we'll do bigger stuff as we get more trust together, okay?
Okay.
Good. Good. You feel all this tension up here? This is where your headaches come from, dizziness comes from, right up in here. And so we're going to affect this indirectly by adjusting the middle of your neck, okay? Just taking my time, no rush, nice and easy. You feel it's already starting to go? It already starting to go right there. Good. What do you think? Wasn't as bad as you thought it was going to be,
No,
huh?
it wasn't.
Yeah. World didn't end.
No.
Yeah.
I anticipated a lot of pain.
You just did. It was fine, right?
Yeah.
Good. Okay, come over here. You know, you could have given me more of a reaction because the camera loves reactions. There's a lot of people out there that like to see big old crying, spasm people.
I thought it was going to hurt.
Can you do that on this side for me? Just pretend? I'm just kidding. Come on, act for me, Dodi. So it wasn't that bad. I'm happy for you. Good. We're going to do this side.
Okay.
This side should be even easier, by the way. Good. I did the hard side first. Okay. Good. Right in here is where I'm going to adjust. Right in the middle of that tension right there. Good. 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 How was that?
Fine.
Fine, huh?
Yeah.
Fine. I think you did good, Dave. Good. I can't wait to see how you're going to do. Okay, so that's all the adjusting for today.
Okay.
Okay, you're going to get up. Now, a couple of important things. You're not going to twist or turn when you get up, right? Just like on the video.
Right.
The more you twist and turn, the more you're going to undo what I do. So just look straight ahead, keep your chin up, and just sit there. You're going to be a little lightheaded. Probably really lightheaded when you get up. That's okay. That's what we want. Okay. So I'm just rubbing your neck now, no adjusting. Good. Okay. Come back this side, please. Grab your hand. Go and sit up for me. Throw your legs over the side. Find a comfortable position on the table. Okay, let's look straight ahead. Lightheaded at all?
A little bit.
Yeah. I would expect you to be more. You're going to be probably more when you get up and walk. And that the reason you are is because I'm affecting that cerebellum I was telling you about. And when you get up, your body is trying to find a new position. Okay, you've been out of position for so long, so you're going to be dizzy for the first lap.
Okay.
And so the walking helps recalibrate your spine. Go ahead and walk the front door, please. You'll be dizzy probably the whole first lap.
Okay.
How are we doing on time? What does it say?
9:40.
Huh, not too bad. That was going to be longer. Good. Now lower your shoulders, please. There you go. Not back, but down. Good. One more time. The front door, please. Now tell me how you're feeling, Dodi. Something feel different at all?
I feel like I could breathe better.
Good. I'm just always curious what people feel like the first time.
Yeah.
You gonna stop right here? You still lightheaded at all? Still lightheaded?
Just a tiny bit.
Okay, one more lap, please, then. Okay. So that lightheadedness is still your body trying to find equilibrium right now. And so I walk to help unwind that. So walking is really key to help settling this out. Okay, a little less dizzy now? Or are you still dizzy?
No.
Good, stop right here. Okay, you really have a real stiffness to your body, so we're gonna have to loosen that up in the future, but you feel different right now, right?
Yes.
You feel like you can breathe better. What else do you feel just off the top of your head? Just always curious. I just want to know first thing off the top of your head.
I feel lighter, like, I was telling you, sometimes my head feels really heavy, like it's like my head's
You told me that, that's right.
Yeah,
I forgot about that.
and it's like, it feels lighter.
You feel taller too,
yeah,
right? A little taller.
Yeah.
Good. So the reason you do that is because I've taken pressure off your spine. You're not being pushed forward anymore. Now you can stand up. So let's go through those range of motions. Go ahead and touch your toes. You guys see this, right? You see it too, Dave, right? Okay, and how much pain do you have?
None.
Oh, can you stand up again? My kids hate this when I do this. They go, "You're gonna do that thing where you say, 'Oh my God, yeah, where?'" Yeah. How much pain do you have?
None.
And did I touch your back?
No.
Did I rub your back?
No.
My wife's shaking her head right now. I do this in all the videos. What did I touch?
My neck.
And in 30 years, how many times has your neck been adjusted?
Once. Now twice.
Now twice. Now go ahead and go back. How much easier is that?
Oh, way easier.
Can you tell that to the camera, please?
It's way easier.
Okay, put your arms down. Now look at the floor.
Mm-hmm.
You had some pain there before?
Yeah.
And now?
None.
Okay, look at the ceiling. Look at Dave. When can I get in? Look straight ahead. Okay, so, again, what did we do in review? We just adjusted your neck.
Right.
The thing that you've been missing for 30 freaking years.
Yeah.
I'm so mad
Amazing.
at that. Amazing. So,
Yeah.
Thank you for letting me do the video. She was really nervous about this, and she was really good. You were really good.
Thank you.
Yeah, you're really welcome. So, we'll take some more stuff. Thank you for watching. So, Dodi, one day I treated you when? 2 days ago.
Yes.
First time. 30 years of chiropractic. And what did I do? I just treated your neck. Now, tell me how you slept that first night.
I slept great. I slept exactly 8 hours. Woke up, felt great. I haven't slept like that since I don't know when. So it was great.
8 hours of uninterrupted sleep, and you don't know when the last time you slept like that?
No.
Fantastic. And then you said you had a thing called heartburn for how many years in a row?
I don't even know years. It just 24/7.
24/7.
Was always there.
2 days ago I adjusted you, correct?
Yes.
How much heartburn have you had since then?
None. Nothing whatsoever.
No. And what did you tell your dad? What did you tell your dad? Your dad called you, go, "How's it working? What's going on?"
I told him, I said it was great. I said, he was asking about it, so I went on and told him how great everything was, and it was just unbelievable. I told him I haven't had the heartburn in 2 days, and he was totally amazed. And I told him, I could see how someone would just go one time and not go back, because it's so many things I couldn't believe just in one adjustment. It's unbelievable.
And just your neck. Now,
just my neck.
You were just telling me, and I stopped you because I go, I got to get this on video. This girl is going off. And you hate the camera too. That's what makes me laugh.
Yes, I do.
And so you started telling me about your foot.
Yes.
And so, what did I touch again? Just your neck, right?
Just my neck.
And so tell me about your big toe.
Okay. Well, before I came here, my big toe's been numb for several years since I had back surgery. And when I curl my toes, I couldn't hardly ever feel my big toe. And now it's like I can feel it again. I can't believe how much so much more feeling is there than I ever thought I'd ever have. They told me that was kind of it. I wouldn't have any more feeling. And it's great. I can feel it again.
Show me those stinking notes you took. I tell all my patients
Okay.
to do this thing. I have 3 things I tell my patients. 1, walk, right?
Yes.
And 1, ice, and the other 1, report.
Right.
And I tell all my patients to do this. Not all of them report what they're supposed to. I tell them, take a piece of paper out and write. So let's see. What did you do? Show me the first day.
So there's one day. There's the first day.
Yes. Show me the second day.
Okay. This is day 2. And this is this morning.
You get a gold star, girl. That is as much information as I've seen in a long time. So anything else you want to tell me that felt unbelievably different? Or
yeah, actually I've had high blood pressure for several years. and I took my blood pressure yesterday, and it was like perfect.
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 Well, what was it before? Can I ask the number before?
It was like for the most, it usually ranges anywhere from 129/86 to 135/89.
Yeah.
It was 118/80.
And when have you ever had blood pressure like that?
Prior to my back surgery.
Which is 8 years ago? 7
years
ago? No, 6 years ago. 6 years ago.
Yeah, and I've been on high blood pressure medicine for about 3 years.
Wow.
So.
And I'm not paying you to do this testimonial. You're not making any of this stuff up, right?
No, not at all.
Nobody's going to believe this at all,
no.
by the way.
No.
You don't even believe it, and you're looking at my camera right now.
I'm still surprised.
Yeah. Anything other miraculous stuff you want to tell me?
My hands aren't puffy anymore. Yeah. I don't at all.
At all?
I wake up and they're like, it's like I feel like my fingers are skinny again. I mean, it's just amazing. Everything. I feel great, and I can get up and like, and then when I get up in the morning, it would be the worst time. It would feel like I was like an old woman trying to walk to the restroom. And it's, you know, when you first get up and it's like I just got up and walked, and I was like, wow, I did that really easy.
I just love all your enthusiasm. It's so different than 2 days ago.
Oh yeah.
Anything else you want to tell me?
That's it, I guess. So far.
Well, thank you so much for this video. This is going to help a lot of people out there understand what we do here and how the neck, only adjusting the neck, can have so many positive things. Yeah. Thank you so much.
You're welcome.